I just want to remind everybody, first of all, as Mimi said, to mute your phone, you press *6*. That way, whatever's going on, whether you're talking to yourself or there's noises in the background, the rest of the people won't be able to hear it. And then if you want to ask a question to Sandy during the question and answer period, just hit *6* again, and you'll be unmuted. Also want to remind everybody that we're recording the meeting from this point on, so that we can make it available on our website for people who couldn't make it to be able to hear Sandy's presentation and the question and answer period. So, don't divulge too much personal information, because this recording is going to be on the internet. If you want to just go by your first name, or use a pseudonym like Yogi Bear or something like that, that's fine. So without further ado, Sandy Lazzaro is joining us tonight. Sandy's a genetic counselor in laboratory medicine and clinical genetics at Trillium Health Partners, which is what used to be called Credit Valley Hospital. Her genetics counseling area is just down the hall from one of the only 4 labs in Canada that does genetic testing for Alpha-1 antitrypsin deficiency. So as a result, she sees and talks to a number of patients with Alpha-1, and has also done a little research, so that I guess she's going to share some information with us about genetic counseling in other provinces as well. We've come a long way in the last few years. It used to be that we had to send our patients to genetic counselors in the States, and that's certainly no longer the case. There's genetic counseling programs in all the provinces now. So I'm going to turn her over to Sandy, and thank her very much for agreeing to take time out of her busy schedule to talk to us, and take it away, Sandy.
Okay, thanks so much, Jim. First of all, thank you so much for having me. This is an incredible opportunity, so thank you. So as Jim said, I have been working, I still call it Credit Valley Hospital, Jim, for 16 years here. And I think one of the most interesting things that I get when I just go out to a social event is when people ask me what I do, and I tell them I'm a genetic counselor, they all look at me like I've just spoken a different language. So I don't think a lot of people actually know what genetic counseling is. So I thought maybe I would just take just a really brief opportunity to explain to people what it is, and that it actually is a profession here in this country. We are a group of, we're health professionals, and we basically have specialized training and experience in all areas of medical genetics and counseling. So we normally would work in a healthcare team, and we would provide not only the individuals, but more often the families as well, with information on the nature of a genetic disorder, the inheritance pattern, identify people that might be at increased risk in that family, talking about the implications of that genetic disorder, not only for themselves, but most importantly for their family members, which is what a lot of people come to ask me about. Of course, we definitely talk about any type of genetic testing that's available, not only in our own country, even if it's in the province, but outside of our country as well. We often organize a lot of testing for our patients that way. And with that, of course, we talk a lot about the pros and the cons of doing the genetic testing. And ultimately, our goal is, and always, is to help these patients and their family members make a truly informed decision about their medical and personal decisions. So, we do provide a lot of supportive counseling. I say that's a lot of what we do. We tend to serve a lot as patient advocates, so often making the phone calls for them if they don't know where to go and reach out, referring individuals and their family members to other support services and so forth and so on. And a big role as well as we act as educators. So I'm often asked to give presentations to healthcare providers and support groups and stuff like that, just to provide this kind of education, because it's really not easy to find this information on your own. So Jim sort of gave me a little bit of a background that I don't think that the community is aware of the services that are available in this country. There are actually just a little over 300 licensed and certified genetic counselors that serve our entire country. We have an organization, and we also have a website. It's the Canadian Association of Genetic Counselors. So if you did want to ever just log on and have a look, it will provide you with a little bit more information as to exactly who we are, what our association is all about. And probably most important for you is it lists every single genetic clinic that is available in this country. And it lists it by province and then by city. And there are genetic clinics in almost every major city in Canada. And certainly if there isn't a genetic clinic right in the city where you're located, usually that genetic clinic is responsible for servicing or providing services to the other cities in its surrounding areas. And that can be done, we do a lot of outreach clinics, and we also do a lot of phone counseling and putting you in the hands of other people that can provide this service. We have what's called a listserv as part of the genetic counseling community here in Canada, and I can't tell you how many times on a daily basis I'm getting questions about, I have a family that I'm following for a certain disease, and they've told me that they have family in such a city in Canada. Can anybody tell me where they can get genetic counseling services? And usually within about 5 minutes, there's about 3 answers. So it's a great resource, and the service really is available in most parts, and should be easily accessible. Now, I can't speak for every single genetics center across the country, but most of us require that you be referred to us from a healthcare provider, whether that be your primary health care doc or one of the specialists that you're working with. I do know some centers accept self-referrals, but you would have to check that out on a clinic-by-clinic basis. I'm pretty confident in saying that every genetic counselor is at least familiar with Alpha-1 antitrypsin deficiency. If they've never seen a patient, they've at least come across it in their studies. It is one of these conditions that is often used as case examples in our studies. And so I don't think I would find a genetic counselor in the world, actually, that if I said to them Alpha-1 antitrypsin deficiency, they wouldn't know what I was talking about. So there may not be people that are specializing in this area, but definitely they know how to handle a family, and they would know what to do if a referral came their way. I think that certainly I've had the pleasure of working with many other support groups. Alpha-1 antitrypsin deficiency is not the only genetic disorder that I see in my clinic. I am a generalist geneticist, so basically I get to see almost a grand variety of individuals and families with a number of genetic disorders. And I once came across a quote that although every genetic condition is rare, you put them together, and every family doctor, about 1 in every 10 of his or her patients will actually have a disease with a major genetic component to it. So together, genetic diseases are actually not that rare. And when I've been part of these support groups, and I get to really know their members and what their questions and concerns are, I would often get the impression that they would say to me, I just feel like we're so alone, that our needs and our issues are so unique. And while that holds true for the medical conditions, the symptoms, the medical issues that you are at risk for, treatment, resources, and all of that, that is going to be very unique to every condition. There's no question about it. But the genetic component, the genetic issues, are actually so similar from disease to disease and from family to family across all races and ethnicity that I think it's really helped me in my practice, because I've been able to draw from all of these different people to help all of the patients that I see. And, most people, when they come and see me, really what they're concerned about is, one, sometimes they're looking for a concrete diagnosis, and I might be able to help them with that. They're looking to know how do they disseminate this information out to their family members, and how do they go about suggesting that people get tested, and how do they even go about doing this? They're worried about their children. They're worried about their siblings. They're worried about future pregnancies if it's a young person that I'm seeing. They don't know whether to do genetic testing or not. They've heard all of these bad things about it in the sense of, I could be discriminated against when it comes to insurance and employment. And, we really do help them sort out what perhaps can sometimes be half-truths or a lot of wives' tales, as I call them, and myths, and help them come to a decision that they feel comfortable with. Nobody pressures them to make any decisions. It's really about just presenting all the options and really having empowered them to make that choice. And so I just happen to notice that a lot of the issues are so similar, depending on, doesn't really matter what condition I'm actually seeing the patient for. So I know one of the things that came up in our discussions is around the genetic testing for Alpha-1, and that not many people are aware that it is done actually within certain provinces here in Ontario. And like many other genetic tests, they often aren't available in every single province and in every single city, just as in the United States, not available in every state. So we are very accustomed to organizing genetic testing that actually occurs outside our province or even outside our country. So if you happen to be hooked up with a genetic clinic that is in a province that does not offer the genetic testing within that province, it shouldn't be too difficult for your genetic counselor or your genetic specialist to organize that testing for you, either in another province, because that sometimes can occur, or we organize it and send the sample to a lab elsewhere out of country that will do the testing. And often the cost of that test is covered either through the provincial healthcare system or through the genetic budget. And so that is always something that we're very familiar with, because many, many genetic tests are actually not even offered in this country. And so we are sending away samples to all over the world on a regular basis to get genetic testing done for our families. I wasn't exactly sure how much the membership knew about genetic testing for Alpha-1 antitrypsin deficiency and how it compared to what's been available for years, and that's the PI typing. And so I thought maybe I would just take a little bit of time to just explain the difference, because that's often one of the questions that many of my patients come and ask me, is to explain that difference. And so I explain genetic testing. I try to take it back to maybe an analogy or a story that I think everybody can follow. And it's really basically about understanding that your genes are ultimately the recipes of your body. And we have over 20,000 of those recipes. The recipes or the genes are not actually what does the job in the body. But every gene produces a protein of sorts. And it's that protein that actually does the job in the body. So when you're in the kitchen reading a recipe and presuming that recipe was written out correctly and you are following step by step, and we'll call it the recipe for a chocolate chip cookie, you are going to get a beautiful chocolate chip cookie at the end if you followed the recipe properly. Now, if I happen to go and change that recipe when you're not looking and I add a few more chocolate chips, you're just going to get a chocolate chip cookie that's going to have a lot more chocolate chips in it. But it's still probably going to taste okay, but it's going to be different than what the original recipe calls for. And sometimes if I go into that recipe and I change the flour for baking powder, if anybody's ever followed a recipe in the kitchen, you know that was going to be a disastrous change, and you're not going to get anything that even remotely looks like a chocolate chip cookie at the end. And so what I try to explain to my patients is that that's exactly how you want to think of your genes working. Your body reads the genes, very much like you and I would read a recipe in the kitchen. And presuming that recipe was written out correctly, you're going to get the perfect baked product at the end that will do its job just fine. If you go and change the recipe in any way, depending on what type of change it is, it might be something the body can tolerate, and it might be something the body can't tolerate. And it will produce different forms of the chocolate chip cookie. And some are going to work better than others. And so that is the biggest difference between genetic testing and the PI typing or the protein testing, is that with genetic testing, you're actually going to the original recipe. And you are looking for the mistake that is in the recipe that never changes, that you were born with. It doesn't matter what you do, you cannot alter that change to your recipe. And when we find that, the results are 100% accurate because we know exactly the change is there. And with PI typing, not that it's not accurate at all, it's just a different way of looking. You're looking at the protein level. And what you're basically doing is you're trying to see what different versions of that chocolate chip cookie the person has. And for years, we were really good at saying, listen, we saw this version or that version, and we were able to tell whether it was the M, the S, the Z version, so forth and so on, using this protein test. But sometimes it was a little bit hard to detect or to differentiate some of the more rare versions that existed, and there were some pitfalls in that testing. And those are things that the genetic testing has been able to overcome because you're going right back to the recipe. And depending on what change has occurred in the recipe, we have a pretty good idea of how that change is going to impact what that protein looks like in the end and how that protein is then going to function, whether or not the person would be at risk of any of the Alpha-1 antitrypsin deficiency manifestations later on in life. So a lot of times people say, well, if I know I have the diagnosis and, I've had my serum levels, I've had my PI, then really why do I need to have genetic testing? And sometimes I'll tell them it's true. It's not going to change your management in any way. We know exactly what we're talking about here for you. But going back to your genetic code and actually doing genetic testing will often help in identifying family members that are at risk because you can't always tell who's a carrier and who's not using some of these other techniques. It's a brilliant way. It's a very quick way of taking somebody's blood sample, going right to their gene level, and saying, yes, you do have the same mutations. And that's what mistakes in the genes are called, are mutations, as your father, brother, sister, whoever it is. And when that result comes back, it's very easy to interpret who may have a mutation and who doesn't. And a lot of times, certainly for my patients, whether it's Alpha-1 antitrypsin or whether it's another genetic disease that I'm working with, the ability to get that genetic test result, know that you're not at risk, sometimes is almost as important as knowing that you are. And I've found in my experience that is one of the biggest benefits of doing genetic testing on family members who are yet they're asymptomatic. And usually these are teens or siblings of individuals that have a clinical diagnosis. And they want to know if they are at risk and a serum level isn't going to do it for them. And they want to know if they are at risk, what they can start doing to prevent any ill effects of this predisposition that they were actually born with. So, definitely the advantages of seeing a genetic case ahead of time is so that we can go over all of this in much more detail. I'm really just presenting just the surface. Most of my sessions pre-test about an hour to an hour and 15 minutes. And it gives the people, they often come with family members, asking me a ton of questions. I certainly do not claim to be an expert on the disease in question. That is not what my role is. And they're often, got very good health care. They're hooked up with the specialists that they need. It's really about the issues of why do they, how is it going to help me and my family? What are we going to do with this information? How are you going to interpret this result? Can we interpret it with 100% accuracy, et cetera, et cetera? One of the biggest issues that comes up in every single one of my sessions, and it doesn't matter which genetic disease I'm offering testing for, is discrimination with genetic testing results, and that would be whether it be against insurance or employment. And I think, unfortunately, genetic testing has gotten a little bit of a bad rap when it comes to this. There's no question about it. If you come to me, it's a public health file. The visit is documented. The fact that you've had genetic testing is documented, and I have a result. If I'm ever subpoenaed, I have to present that to the court. Now, to my knowledge, a genetic test result has never played out in a court of law here in Canada, but that doesn't mean it can't change. I think that in many ways, genetic testing and the results that we have are not so dissimilar from many of the other very routine tests that people have when they go see their family doctor or other specialists. And you are identified at being higher risk of some type of condition that you had no clue about, but you just went in for a routine blood test, and voila, they found something, and it's followed up on because that's good health care to make sure that you don't fall into trouble. But that's on your file, and your insurance companies can get out. So it's not so dissimilar in the sense of other medical tests that are run on a regular basis. And like anything else, it's sort of trying to weigh out with the family what the pros and cons are so that they can make the informed decision of saying, yes, I risk everything else, but what I can get out of that, what my family can get out of this information outweighs it. And for some families that will, and for some families it won't. But we sort of help them work through a lot of that. And you know, hopefully they'll come to a decision that they're very comfortable with. I mean, personally, a lot of the patients that I see already have a clinical diagnosis, and they're looking to do the genetic testing to just find the mutations in the gene that are responsible for their disease to make it that much easier for other family members to get tested. And then from that, I do end up seeing a lot of the family members who are then coming forward who are perfectly healthy individuals who depending on what their questions are and whether their main concern for their 5-year-old daughter, we do talk about alternatives and saying we don't need to test your 5-year-old daughter right now, but perhaps we could test your spouse because the genetics of the two of you will dictate what your children could be, and that may just solve. So, you know, we really do try to give everybody alternatives into testing, especially when it comes to young children. Ultimately, this is all about prevention. So much of what we do here in our genetics clinic and in offering genetic testing is for prevention as much as we possibly can, whether that be for identifying somebody that is predisposed to Alpha-1 antitrypsin deficiency so that they can make some good life choices earlier on in life versus when I test somebody for a breast cancer gene predisposition and, you know, I set them on a course of what they need to do to be careful. It's really, as much as we can, trying to play a preventative role and, you know, just working with the families to make sure that we give them as much of a personalized health care as we possibly can.
I'll give you $2 if you go right to sleep.
So I think that's pretty much all I wanted to just throw out there in my general presentation. I didn't want to get into too much details because I actually wasn't sure if I had about 20 or 30 minutes or so. So, Jim, I'm not sure if you wanted to open up the floor for questions or...
Yeah, sure. Why don't we open things up for questions? I might point out to someone who's whispering and thinks we can't hear them that we can. So you might want to use the *6*. So are there any questions? Who wants to go first?
I have a question. It's Mimi. I'm wondering, Sandra, if you can explain to our audience a little bit. You talked about the PI testing. How about the geno testing?
Okay, so genotype testing is the genetic testing. So that is just a synonymous word for genetic testing. So the best way to describe it is your genotype is the recipe you were born with. That is your copy of the gene that you have directly inherited from your parents. And that is a person's genotype. So you don't know what your genotype is for any gene unless you actually have genetic testing and we read your gene to tell you whether or not that recipe was worded out correctly or not. Your genotype directly produces your phenotype for the most part. And your phenotype, in this case, would be the protein that is being produced by the copy of the gene that you have. So if you have a faulty gene, there is a mutation or a mistake in the way that your your gene for alpha-1 antitrypsin was worded or written out, you are going to produce a protein that isn't as functional. And that is your phenotype. Your phenotype is how you show or how you manifest the instructions that you inherited. And so with that protein not working so well, over your lifetime, you may be at increased risk for lung and liver disease and everything else that can go with alpha-1 antitrypsin deficiency. So when you're manifesting with liver disease and COPD and whatever else that you happen to have, that is your phenotype. That is how you are showing your instructions dictated. Does that make sense?
I hope so. So do others have any other questions about that? I know this is always difficult for people to understand the differences between the geno and the PI testing.
Yes, and so that's why I tried my best to use that sort of recipe analogy. And this is why, sometimes the phone counseling is fantastic. I know so many genetic counselors that do this for a profession, but I'm itching here to draw a diagram. and to show you in person using my hands and drawing diagrams. And so this is what we do. We're teachers by nature. So the phone counseling can be a little bit difficult, but once you start to draw things out and I can show you it sometimes it does clarify it. But I hope that, if you can just go back to my recipe example, it's the cookies that we're testing when we do the PI typing. We're trying to see which versions of the cookies your body is producing. Is it the one that's the perfect cookie? That is what most people produce? Or is it the one with too many chocolate chips? Or is it the one with too less chocolate chips? Or is it the one that's smaller or bigger? Or are you just not making any cookies at all? And for years we were able to use that to say, okay, this is probably the pattern of somebody that has the Z version or the S version of their gene. And with genetic testing, I'm actually going back to the recipe. I'm going to the original source, and I am reading that recipe letter by letter, and I am checking for any spelling mistake, any differences in that recipe. And I know that for every person with the Z version of the gene, the mistake is on page 2, line 3. It was the 2 cups of flour that got switched to baking soda. And that is why that is a very important change to the gene, because it is a very drastic alteration to that recipe. The S version might be, too big or too small. Where you're not producing any chocolate chip cookies. Well, we know that basically your gene isn't working at all. So they are connected, but one is the actual recipe you were born with, and that dictates the type of alpha-1 protein you make.
Okay, are there any other questions?
Can you...
Hello?
Go ahead.
Yes, it's Katie speaking. Have you noticed in your testing if there's an ethnic group that is more predetermined to get this Alpha-1?
Great question. So I happen to be in a very diverse area, so I'm very lucky. And predominantly, I would venture to say that Caucasian. We have such a mixed group here of even within that population that we haven't been able to subtype it into Northern Europe, Eastern Europe, Western Europe, those types of things.
Thank you.
Thank you.
Anyone else?
I have a question.
Mm-hmm.
I have a question.
Go ahead.
This is Debbie from Edmonton. I'm just curious. The explanations that I've had have been all really good, and I've been to a geneticist already. My concern is generations down the line, like if my family does not want to get tested, what are the ramifications possibly down the line for generations to come? Like, how important is it to get this testing, whether we get it done privately and nobody sees the results, or...
Yeah.
Do you know what I'm saying?
Well,
how important is it to get the rest of the family tested?
I mean, ultimately, the word importance, I think that has to be determined by everybody. I mean, so Debbie, I'm not exactly sure. Do you have ZZ? Do you know, or you don't want to?
I have an SZ.
You have an SZ. Okay.
SZ. And some of us with SZ, like there's quite a few people that have the SZ, but some are way sicker than the rest of us.
Oh, for sure. And again, the way that I try, there are some genetic diseases, Debbie, that basically we know if you have a bad gene that causes that disease, you will 100% develop that disease, and it will be a very severe form of it no matter what. And, one good example of that is Huntington's disease. And I'm not sure if people are familiar with that or not. But with most genetic diseases, like Alpha-1, even though you may have 25 people in the room that are all SZs, there are so many extraneous factors that influence whether or not you will actually develop your symptoms. And some of these things, we just don't know what they are. And it could be just how your other genetics are working to keep you in check compared to somebody else. It could be exposures that you've had. It could be a combination of all of that it will show up in one way in one person and in another way in another. So that is the beauty of the human body and genetics, that you can have the exact same genetic code or the same mistake in the gene as somebody else, and you may not always show the same disease in the same way. And that doesn't just apply from different families. That also applies within the same family. You could have a brother-sister, a mother-daughter that are both SZs or MZs. Let's take even something like that. So what we would normally have said is just a carrier of the genes. The brother has been smoking since he was 14, and the sister lives an exceptionally healthy lifestyle, and he may have some breathing difficulties later on in life, and she not.
Wow.
It will manifest differently even within the same family because, our genetics work so in tune with each other in our own body that you never can predict with 100% certainty how that's going to manifest in somebody or how it's going to show itself up. Now, that wasn't the answer to your question. Your original question was how important is it that my family get tested?
Well, but you did answer it because the second part of it really did answer it.
Okay, good.
I'm good with that.
Okay.
Thank you.
No problem.
Hi, it's Mimi. I have another question.
Sure.
Sandra, down the line through, as we continue to Mary and our offspring. Is there a possibility here in terms of numbers that this would be, these defective genes would be eradicated in our generations?
Absolutely. So it really depends on which copy of the gene you pass down. So nowhere in this did I actually explain that you have two copies of every gene in your body, one that you get from your mom, one that you get from your dad. And so a person who is a ZZ, SZ, the reason that you're giving me two scores is because you have two copies of your Alpha-1 gene. And you really need to have, generally speaking, both copies of that gene not working very well, so that the proteins that both copies of the genes are producing are not giving your body what you need. And so that's why you're at risk to have the symptoms of whatever disease that is. When you go to have a child, you are only ever going to pass one copy of all of your gene pairs, because the other copy of that gene pair comes from your spouse. So, for example, we'll take an SZ person. When they have their babies, every single one of those babies will either inherit a Z or an S from that parent. They have no choice because they've only got two copies of the gene, and on one copy she's an S, and on one copy she's got a Z. So she's either going to pass on the Z or the S. And now she happens to marry somebody whose both copies of the gene are completely normal. Then their children are at least going to get a perfectly healthy copy of that gene from the other parent. So now we're going to take the daughter of that person, and she inherited the S version from her mom, but the normal from the dad. So she's an SM. Now, when she has children, she's going to either pass her S or her M. And if she happens to marry also somebody who carries this disease, and she passes the M version to her son, and the husband passes his M, of course that's all he has, to the son is now MM, and he no longer carries this disease.
And how wonderful is that? And so, that's why I asked the question. I wanted everybody to know that there is hope.
Absolutely. And unfortunately, it's nothing we have control over. So it would be nice, and I don't know what 5 years or 10 years is going to bring us. And you know, all joking aside, there are methods of prenatal testing and figuring out if embryos are affected by genetic diseases before they are implanted back into a woman. That technology has been available for years. But traditionally, people do not want to go to that length. It really is a flip of the coin as to which copy of the gene you pass down. And all of these myths that are out there, and I do genetic counseling, sort of awareness days all the time, all of these myths about, well, I have no hope because I look exactly like my mom. And so I'm going to have all the genetic conditions that she had. That holds no water. So you are 50% genetically mom, 50% genetically dad, and it's all luck of the draw which gene copy you got from each of them. And if things work out to somebody's favor, that scenario that I just told you only took 2 generations to get to a grandson that is MM.
Now, isn't that exciting?
It is, actually.
Which is why I've said more often with the little ones, when people come and say, I'm really worried about, I've got a 12-year-old, a 10-year-old, and a 7-year-old, I'm not going to subject them to blood work to have genetic testing done or even measuring their Alpha-1 levels, nothing like that. I'm basically going to say, let's test your spouse. Because the odds that the spouse is a carrier is so low to begin with, and at least they're an adult. And most people already have their insurance policies in place, and, is a pretty healthy person. And when I get that genetic test result that says, yeah, your husband's an MM, so we know you're not at risk of ever having children with a predisposition to Alpha-1, but I will go down the scenarios of what their children could be and what we need to do when they get older.
Sandra?
Yes.
I have a comment to make.
Sure.
Hey, this is Joy from North Bay. I'm ZZ. My husband is M variant. Now, my 3 boys are M.
Okay.
So I'm not sure what's going to happen with the grandchildren because they haven't been tested. So is there any possibility that they will end up with ZZ?
It all depends on, how old this is your children you're asking, or your grandchildren?
No, my grandchildren.
Your grandchildren.
My children are M.
And these are the children of your daughter or your son?
No, they're all boys.
Okay. So it really depends on what their mom's results are. So if your children, they'll at least have a Z. And it sort of depends on, whether they inherited the M variant or not as well. But if their spouses are normal, normal M, depends on what your children got from your husband.
Right.
Then those are where we could draw out all the possibilities, and there absolutely is a possibility that they could have nothing.
Right. Right. Well, we have three grandchildren, and they haven't been tested, but, you worry. But so I just thought, well, I'd ask. And also, I wondered, there just doesn't seem to be, in the North, there doesn't seem to be much information that the hospitals and the different professionals have with Alpha-1. Like we go into the hospital and sometimes someone will know something and then another time they say, what's that?
Absolutely.
It's not just in the North.
That is just not in the North.
Is that Jim?
I assure you.
There's a general, keep in mind that there's 7,000 rare diseases, and not every healthcare professional is going to be an expert in all of them.
Right.
And so, that's part of what, of course, what we do is try to raise awareness amongst healthcare professionals of the disease and then how it works. But as we all know, we did a survey a few years ago, and it takes people from the time they get symptoms for a lung-affected individual. It can take up to 10 years till they finally get the right diagnosis.
Right.
For a liver-affected person, it can be 5 or 6 because there just isn't that information. A lot of the doctors who are and other healthcare professionals who are practicing now, remember this disease was only discovered 50 years ago.
Right.
So a lot of them didn't even learn about it in school. So unless they picked it up somewhere else, it's something they're just not looking for. And just to complicate matters is that when somebody who's lung affected, when they do go to the doctor or the hospital, they look a whole lot like they have COPD. And doctors see dozens of people every day who have COPD. And if they're lung affected or if they're liver affected, they look to, a general practitioner or whatever, like, maybe they drink too much or maybe they have some other liver disease. But until the genetic testing's done, we don't really know, right? Whether you have COPD because you smoked or COPD because you worked in a factory that had fumes, or because you have Alpha-1. Until
I was kind of diagnosed as a fluke because I had a lot of infections, and my doctor told me that he had taken this in school and he had tested other people, but nobody ever was positive. And so he did the testing, and when it came back, he says, I've never had another patient that has had that.
Yeah.
So,
and you're not alone, and
no.
I'm here in Toronto for all intents and purposes, and so many physicians have never heard of it.
No.
And with so many other genetic diseases that I deal with on a regular basis that are so rare. And unfortunately, it's with groups like yours where we do try to educate as much as we possibly can. But it's like with anything, I often tell the families that unfortunately the burden is going to have to fall on you to educate them.
Well, Tim was kind enough to send me some pamphlets, which I have been able to distribute around here to try to, make people aware, but it takes time, I guess. Anyways, thank you very much, and I've enjoyed talking to you.
No, likewise.
Okay, take care.
Mimi, I have a question.
Okay, go ahead.
It's Michelle. I'm a ZZ, and I have a question. My mother refuses to get tested. I know that my father was an Alpha-1 patient, and I guess my question would be, if I'm a ZZ, I would have the Z from my father and the Z from my mother?
That's correct. So we know at least this is a very interesting topic around genetic testing, and something that we bring up with our patients all the time is that by testing one person in the family, you have automatically at least half of your genetics of your parents. So you've laid it out beautifully. You've gotten one Z from your dad, and you have gotten one Z from your mom. We know at minimum your mom carries at least the Z allele. So
my daughter would get the Z from me, and whatever her father was, and he's not Alpha or anything, so she would be an MZ then, right?
That's right. So you would have to double check, though, that he's not hiding an S or a Z. And so that's why I'll often suggest to people that you test the parents first, because often people have more than one child, and knowing what the parents' versions are, you can automatically make predictions about what the kids could be. And then you can make a case for whether or not we really want to test them or not.
Right, because I know my daughter was tested, and supposedly she's just a carrier right now, but it's impossible to test her father.
Right. So that's fine. So, but at least, so that would be a case where I would say we know at least she's going to have a Z from you. So it depends how proactive you want to be, and if you feel that this is the right point in her life, and you make a decision together. Some 14-year-olds, some 12-year-olds are more mature than others, or they're having health issues, and you really need to just rule this out. You make sort of decisions family to family, but, there's some great studies out there that say that if you provide an adolescent with their, this is called their genotype, so the M's, the Z's that we pick up by genetic testing, that even the MZs, if they smoke, could be at risk of lung issues later on in life. And so a lot of these adolescents will actually use that information and will actually make healthy choices and active choices not to put themselves in that situation. And so if that's as much as we can do, great.
Right, exactly. Yeah, no, my daughter doesn't smoke. Now, my daughter was also born with 2 fingers together and 6 toes, which genetically comes from her father's. Yes. Would you be able to test something like that for her children?
You know what? We actually don't have the gene for that yet. We don't know if it's just one gene that causes that or if it's a multitude of genes. We do know it is hereditary. And it's something that, by the time she has children, I don't know what we're going to know. But that's something that we would find on fetal ultrasound. That's the tool that we would use.
Okay. Thank you.
No problem.
Any more questions?
I've got one. What is an M deviant? Is that what you called it?
M variant?
Variant. M variant. Yes. What is that?
We talked a lot about the M, the Z, and the S.
Yes.
Because by far and far, those are the 3 most common versions of the recipe. Okay? And so most often, those are the ones that you're going to come across. But we will also find other changes in the gene that will make a protein that is not as functional, and there are a lot of different versions of these types of proteins. They're rare. They're more rare, and they've been given names very fancy different names, sometimes after cities, sometimes after the position on the gene, and we've gotten used to knowing what the implications are of having these other versions or other variants of the normal gene.
Yeah,
Okay.
in fact, this is Jim again. I read a study a couple of years ago that said there were at least 168 different versions that we knew of. I read a study recently where they found another one, so I guess it's around 169, except most people have an M, an S, or Z, except for these.
And up very recently, the genetic testing that we offered was to look for just the M, the S, and the Z. And it's only been in the last 2 years that we now do, now I can only speak for our lab here, but we do what's called full gene sequencing. And many people have heard of that terminology, but that is literally reading the Alpha-1 genes, and we would read both copies of your gene from start to finish, looking for any differences. And that's where we would pick up all of those other different versions. And so if you
And what's that called? Full gene sequencing?
Full gene sequencing, that's right.
So like I've been to the genetics counseling, and do I have to have my doctor book the appointment, or can I just phone there and rebook it and get that done if I wanted?
I think it depends what your result was. So if, for example, if somebody had the older technology of DNA testing and you were discovered to have a ZZ,
yeah,
we're not going to find anything new now.
Okay,
those are your versions of the recipe.
Okay.
Okay? It's only for people, so for example, people that they're showing symptoms, for all intents and purposes, they have the clinical diagnosis of Alpha-1 antitrypsin deficiency. There's just no way around it. And we've done their genetic testing, and they've got 2 copies of the gene, and 1 copy had a Z, but the other copy, we didn't find the Z and we didn't find the S. And we're thinking to ourselves, but this person has the disease. What is going on? And so it's because we didn't go looking for all those other 168 different versions that it could be. And now we do. So for a lot of those people, we're finding that second mistake that they have. It's one of the other versions of the gene that it could be that is still responsible for a predisposition to the disease.
And this is where you will hear sometimes where someone will say I'm a Z null, for example.
Right. So that's right. So a null is basically another mistake that can happen in the gene that causes you to produce absolutely 0 Alpha-1 antitrypsin protein. So a Z null is, for all intents and purposes, a predisposition to the disease, just as a Z null.
I believe there was someone else with a question.
That was me, and actually it was about the null gene, what exactly that meant. So we got into that.
But, knowing the mutation, the type of mutation the person has can be very helpful because, we have one patient that's a null, and we know that they are basically not at risk of liver disease because they're not making any protein, and it's the proteins that are Zs and S sometimes when they don't fold properly that are getting stuck in the liver, and that's what's causing the liver symptoms. Well, if you're not making any of the protein, you are at least not at risk of that part of the disease. And so knowing what mistake it is that you have on both copies of your gene can sometimes help us dictate what you may or may not be at risk of.
Now that's interesting.
Now, I've asked a question before about diet and whether or not, how some people that have liver disease, other liver diseases, have to watch their diet. Should alphas be careful as well? Is there anything that we should stay away from?
That is not my area of expertise. I mean, I did speak to a hepatologist once that was caring for one of my Alpha patients. And his answer to me was, although it was nice to know what was causing the issue, I treat it like any other patient that has fibrosis or cirrhosis of the liver or fatty liver. And I encourage similar types of behavior. Avoid alcohol, avoid any type of hepatotoxic agents. So, for example, if you need to be on a medication for something else, and there's an alternative where a medication will process through your kidney instead of your liver, then that would be a better choice for an alpha. And, of course, any restrictions that keeps your liver healthy is never a bad thing.
Okay.
That was sort of his explanation to me, and, of course, I'm sub-quoting somebody else, so, it's really important that if you have liver involvement, to speak to your hepatologist to get the best care for yourself.
Everybody should watch what you eat.
Well, that's true, too.
I think, too, also, if you need more information on the dietary stuff, please contact Jim or I. I mean, there's stuff on our website. There's on podcasts on it. Our nutritionist, Beth Halliburton, has written some overviews for us on our website as well. We could provide you with some general information.
Hey, that'd be great. Thanks.
You're welcome. Any other questions?
Well, we've gone about 10 minutes over, so I guess on behalf of Alpha-1 Canada and the rest of us on the phone here today, thank you very much, Andy. And if you have any more questions that have come to mind, please don't hesitate to get in touch with us, and I can get in touch with Sandy or on the nutrition issue too. And I mean, I can get in touch with Beth if the questions you have aren't answered by the stuff we have on our website. And any other information people want to know. I mean, that's why Alpha-1 Canada is here, is to raise awareness and inform and educate the patients. And we're more than happy to do that. All you have to do is call the 800 number. So again, thank you everybody for attending. Just one little piece of housekeeping to do. We said that one lucky caller would win a $250 gift certificate from Via Rail, and I sat here and wrote all the phone numbers that called in from the call display onto a little piece of paper and put them in my baseball hat, and I pulled one out. So if the person whose phone number ends with 1588 can stay on the line so I can get their information and get the certificate to them, that would be great. Otherwise, everybody else, thank you, and good night.
Right. I just want to add one other thing as well, and just to encourage you to join our support groups. This is what we do on our meetings, is to bring up other topics that people are really interested in, and by networking through those support groups by teleconference or face-to-face, depending on what province you're in, brings up all these topics. And so there's lots to learn and lots to share. So please, if you're not a part of a support group, give us a call.
Let me ask that one more question before everybody goes.
Sure.
It was mentioned that people with the liver problems, that there are other medications that run over the kidney compared to the liver. Now, my understanding is anything that you stick in your mouth goes through your whole body. So how can a medication just go through the kidneys compared to the liver?
Generally speaking.
Do you understand what I'm saying? It's just kind of like, huh?
Yeah. Yes, of course, anything that you take through your body technically goes through the whole body, but my understanding is that certain medications are processed more in either the liver or the kidney. Now, like I said, that was just something that somebody told me once, but it's really important that you discuss case by case, and obviously liver specialist.
Yeah, and that's where I wanted to have clarification, because I'm both Z lung and liver, and I am so freaked out in taking stuff because it does go through your liver, right? So most of the time, and this is, I guess, just awareness for everybody else, but most of the time I do talk to my specialist or my physician to say, wait a minute.
Exactly, and that's something that they're not always going to think about, and to say, no, I don't want to take this, even though that's usually what somebody would take because you have something completely different, whether it be something temporary, because anything that can go processed through your liver, or you have to ask them, does this get processed through the liver, and what they're going to do? Because
a typical statement, like, I mean, even if you read the labels or whatnot, something as simple as Vicks VapoRub, there is a warning on the label, if you have a liver disease, do not take.
So there you go. So I think awareness like that maybe somebody wouldn't put the connection together, like just taking a Tylenol or, those types of things. You really need to discuss any type of medication, whether it's by prescription or whether it's something you can buy at your local pharmacy. If you have a predisposition to the liver component, you really need to make sure that everything that you're putting into your mouth is not going to add to the stress of that liver.
Right. And I guess that's where the dietitianist comes in, too, because even some of the herbal stuff is the same thing.
Well, and that's just, I think, a common misconception, is that if it's natural, it's safe.
Yeah.
And, that's not always the case.
Yeah. No, I just wanted to make the group aware of that.
Yes, for sure. Thank you.
Okay.
Well, again, thank you to everyone, and I hope the person with the number ending 1588 in their phone number stays on the line.
That's me.
Oh, good.
Congratulations.
All righty. That's wonderful. For everyone else, thank you again. We look forward to speaking with you and getting another guest speaker. And Sandra, most appreciated.
Anytime. It's my pleasure.
Thank you. Good night, everyone.
Thank you, everybody. Bye-bye.